The customized implant is, by definition, adapted to the patient's actual anatomy. From an operative point of view, one has to change techniques and simply figure out the patient's anatomy to fix the implant in a very accurate situation.
Bien précise, l'implant. Ici, on a une coupe à 11 mm. Là, il faudra bien se méfier de ne pas couper trop bas pour que la tige reste stable. Ici, c'est assez remplissant. Je pense qu'elle va être très stable en rotation. Par contre, là où on va avoir des difficultés, c'est sur toute cette zone avec un spongieux qui est très dense. Très dense.
Il faudra faire attention au fraisage.
Ah oui, on a un
très
fraisage
important.
ici, effectivement.
A hip is a very deep joint. To implant a prosthesis, the first surgeons used to cut the bone directly. Nowadays, we can insert an implant without having to cut through the muscle, which demonstrates our respect for the patient's anatomy, but also allows a complete muscle recovery after the operation. A hip implant intervention involves 1 hour and a half of surgery, general or loco-regional anesthetic, a team of 2 or 3 persons to perform the implantations, a short stay in hospital, and a functional recovery of about 6 weeks, with great individual variation. Customized hip implants, like all other interventions, remain a medical matter with its risks, and thus the success is not 100% guaranteed. Nevertheless, the technology used offers obvious benefits in terms of security and operative accuracy. With techniques that respect the muscle and enable the incision preoperative planning, we can reduce the size of the incision and end up with very discrete scars. The size of scars depends on numerous parameters. We can insert a hip implant with less than a 10 centimeter incision, and it can easily be done. There's a very special moment when we operate on a patient. It's the moment when we open the bag and discover the hip implant. It's a unique object. Think of the feeling you have when you hold a unique object in your hands, and that this unique object is accurately adapted to the patient, who is also a unique patient at the time in this particular area of the operating block. These are times that really transform the world of surgery.